thank each of the panelists for taking time to be here with us today. We really appreciate it, and I'm looking forward to hearing about your experiences and your reflections. Well, let's get started with some introductions, and maybe we can just start from Rosemond and go down. If you could introduce yourselves, your organizations, and then your role in that organization.
Good afternoon. It's a delight to be here. I see a familiar face from last year. And my name is Rosemond Owens. I am a mother, storyteller, activist, but most of all, I am a fearless advocate for the underserved and marginalized. I do work for Blue Cross Blue Shield of Minnesota. The company has a commitment to eliminate health inequities in Minnesota. So within our lifetime, maybe it won't happen. And I lead the internal work, health equity integration in Minnesota. And I'm happy to be here.
Hi, I'm Donna Fishman. I am currently the director of the National Center for Children's Vision and Eye Health at Prevent Blindness. I have one familiar face. And I'm also an activist, and I've devoted my career and volunteer life to improving the lives of women, kids, families. So really happy to be here and share some of my experiences.
Thank you. My name is Jill Farris. I graduated from the School of Public Health in 2005, and I'm discovering some connections with folks that I'm on the panel with, which is not unique. I think you will find as you go out to the world, your connections in MCH will take you everywhere. So I work here at the University of Minnesota. I work in the medical school, and I work for a CDC-funded center called the Healthy Youth Development Prevention Research Center. So my title is very long, but very descriptive. It is the Director of Adolescent Sexual Health Training and Education. So it describes exactly what I do. I gave myself my title, so just so you know. I think my title is like Program Specialist 3 or something very boring. So I gave myself my title, but it describes, again, very well what I do, and I'm really excited to be here and really honored to share the stage, table, front of the room with these folks.
Okay, I'll start. The program was really instrumental in my career. It gave me the background I graduated in 1991, so this is going back a long time. I started 30 years ago this fall, so yeah, it's been a really long time for me. But I really learned about all of the federal programs under maternal and child health, and that information and understanding those systems has helped me throughout my career in applying for federal grants and just understanding the systems. And much of my work was in teen pregnancy. That's where we overlap. And I didn't really interface so much with many federal programs, but over the course of my 30-year career, I have. And so that information was really helpful. What I will say I also got was exposure. So the first guest speaker that came to my very first maternal and child health class, which was maternal health, starting with family planning, was the state family planning coordinator. And I chased her out of the room. I said, that's the job I want. That's why I came to school. And we've remained very close friends. I'm staying with her this weekend. And she then helped me get my internship and my first job, which opened up all the other opportunities for my Plan B, my master's project, and everything else. And so the connections also were really instrumental for me.
So just like you said, I think that program was very instrumental, So as you know, passion alone cannot do it, right? You need some sort of credibility. And at times, also being a woman of color, you need an extra dose of credibility. So having that MPH at least gets you a seat at the table, right? And helps you have a critical voice at the table. So like you said, it was very instrumental. But for me, also, the program is such that you can make it anything you want. Right? So when I tell people, I can be almost anything I want. I can apply for any position that I want. And I actually do that. I apply for positions just for applying sake, right? Because I want to test my hypothesis that the MCH program is the most versatile program you would ever. Because the breadth is so much, so you can be almost anything you want, you know. I exaggerate a bit, but you know, so don't live here and go want to be an empty down and work, right? So I hope you get what I mean. But, so in terms of how it's allowed me to be successful, besides the credibility, I think those core components of the program are very important, right? So the public health core and the MCH core is almost helps you be it's more holistic, you know. So I know that at times we berate core courses that we have to, but they're really important, right? So I think that so an example I want to give is my 13-year-old is also an activist, and she's an uninformed one, right? That one you don't want. You want to be so those core courses, whether it's public health or the MCH, actually grounds you, right? And then gives you that kind of credibility that you need so that you can be, not like my 13-year-old, but you can be an informed, credible player at the table.
Answer is it's everything. I would not be where I am without the MCH program. And so the longer answer to that is that when I was, I've had 3 jobs since I graduated. One of them, I got the connection from a professor that was my advisor. The next job that I took, I had for 8 years, and I got that job because it was I'd like to think I had some skills to bring to it too, but the connection that I had was that it was my field experience in between the 2 years of the program in the summer. And like Donna, I have a story of sitting with my site preceptor and the executive director of the organization at the end of the summer, and they said, where do you see yourself? What job do you want? And I was like, can I come work here? Can I have your job? It was exactly that, and of course, it took a couple years, but I ended up, working there and being there for 8 years. And then now the organization that I work for at the University of Minnesota was the place where I did my research assistantship, my grad RA, when I was in the MCH program. So I have had a very deep and personal connection to all 3 places that I've spent time as a professional, and all 3 of those places were direct baton passes from folks in the MCH program. So for me, the short and long answer is that it wouldn't be possible without the MCH program. Well, I think you all know the answer, which is right away. I don't think it's too soon at all to start thinking right away, and I've had a couple conversations with folks in this room over coffee in the last couple of weeks, and it's some of you, your first semester of school. So, I think getting out there as early as you can and asking questions and meeting folks is always a good idea. In terms of, so my advice is actually going to be a little bit contradictory to my story, which is that I think that you should pursue your passions, and the areas that you love and that call to you and that are like your home. Do that. Find those places. Do those things. But I think the growth and the networking comes when you challenge yourself to step outside of the things that you normally do and the people that you normally talk to. And in the world of sort of adolescent health and sexual health and reproductive health, we're a very small crew. Like we're a kind of a tight-knit ship. We're a close friendship, I'm trying to say, in Minnesota and in the Twin Cities in particular. And so I think that's good, and you want to make sure folks know your name and know who you are and whatever field that your passion is in. And I think the places where I found myself growing the most, learning the most, making connections the most was when I challenged myself not to do that. And sometimes it was actually my advisor who was the one who was like, she taught the reproductive health course. She was like, don't take my class. She said, all this stuff, which is kind of amazing actually, that she would tell me, you already know this, go do something else. She was like, go take a class in nutrition, go take the class in policy. And so I did. And those are the things that, even though I absolutely love, of course, my coursework is sort of my passion area, I think for me, it was also a really good opportunity to step outside of the kind of my traditional, like, sort of sweet spot and do something different. So that's a piece of advice.
I totally, absolutely concur. So I'll just tell you a little bit of my story. I am from Chicago, and I went to school at the University of Illinois in Champaign-Urbana. Worked for 3 years in local public health departments, a family planning counselor, and sex educator, and knew that I was, by the end of undergrad, I knew I was really interested in public health, but wanted to get some practical experience before coming in. And at that time, I don't think the program accepted people who were right out of school, right out of undergrad. So when I came here, I wasn't thinking about the future. You know, where would I be in 5-10 years? So I ended up staying here for 10 years, and great career was wonderful, but then my husband and I moved back to Chicago. And so I guess, one thing I think about is moving, think about where you're going to be long term. Because if you are here and this is where you're staying, build up the network. So what happened to me is I moved back to Chicago, and I had a connection and did get some consulting work back at the health department I worked at. But I struggled a little bit because I moved to Chicago, where they have an excellent public health school at the University of Illinois in Chicago, but a number of public health programs. And I was competing against all the locals who had those networks and had done their field experience and everything we're talking about. So I didn't stay in the field of teen pregnancy, which is all of my job experience. And so I guess I really concur about broadening your, and I've made it work. I have made it work with that MPH in maternal and child health. But I'm sure I've been passed up for things because my focus was very narrow. So I agree. One thing I would say, and Bianca and I were just talking about this, was I felt, and I don't know what the curriculum is now, but and Sarah and I talked a little bit about this too, that I got a really good knowledge base, but not so many practical skills for running an organization. I didn't know how to read a financial statement. It was a 1-credit grant writing class and didn't get feedback on our 1 grant we had to write. And so if you're thinking, even if you're a program coordinator, you're budgeting and you're managing people. And what does that mean? And that's the kind of stuff I ended up going to University of St. Thomas and getting a mini MBA to get some of those skills because they taught us some about accounting and all that. So, it's hard to know. I mean, maybe some of you know this is where I want to be, or, I'll stay in Minnesota, but I got my first role in Chicago, a big consulting job with a CDC-funded project because the project officer knew me because I'd sat on a national board. So one of my messages to you is to volunteer, even if it's not a field experience. My Plan B Master's project was with the Minneapolis Public Schools, so that exposed me to the folks who run health services there. And so a lot of it was connections that then you can use, later. So
that's great. So to piggyback on what Donna just said, taking advantage of opportunities all around you, right? So that was one of the questions: is how do you prepare to work with people with diverse backgrounds, right? I will reframe that question: how do we prepare to be human, right? So you are competing with a global community, right? You are also right now going to school in the Twin Cities metro area, which is one of the most diverse areas in Minnesota. So there's many advantages. And start with, look around you, right? You can decide to make a goal of meeting everybody in your class. You can actually do that so that by the time you leave the program, you have a whole swath of colleagues with different backgrounds. But you need to go out of your comfort zone, right? So again, I have an 18-year-old. She is in aviation program at UND, right? The aviation program is so instant. And I said, don't do that. You will graduate with a pilot with no other skills. in this global economy, you cannot live like that. So guess what she did? She joined the rugby team. But the only problem was, I said, do black people play rugby? I don't even know right now. She's playing rugby, you know. So how do you extend yourself? How do you intentionally create opportunities for yourself to meet people who you ordinarily wouldn't, right? So look, we are here. Within 12 miles radius of this university are all these hospitals and care systems. It's like you are inundated with them. So I used to work at Hennepin County Medical Center. Even the Latino population was about 40%. So can you imagine just taking the bus there, looking for opportunities there? Donna talked about volunteering opportunities, right? There's Alumni, there's Fishman, so all around you, right? So that you can get some of that clinical experience. So this will be very interesting. I started my career in the United States working in the birth certificate office, right? Even now, it's paid me back so many dividends, right? So I just joined the March of Dimes board of directors. And guess what? It was so because it was like working at the birth certificate office led me to find this program because I realized that, oh my goodness, when you are in Ghana and you watch TV, America is a paradise. So when I came and I was working, I said, wow, is this the America that we know of in Africa or this another one, right? But it turned out it was the same America, right? So I learned about disparity. So for 8 years, I honed myself in that field in a lot of skills that I wouldn't have had otherwise, right? So when I came here, it was like almost a continuation. And I've seen that all the experiences that I had, all the volunteer opportunities that I had, all the opportunities that I got here. And you know, usually when there's events, I like to eat. So when there's free food, of course, I will go to things. And my initial idea is just go for the food, but then you get something sparks your interest. So if it's nothing at all, just go for the food. Something else will happen. Okay, I believe in me.
I just want to add one more thing. So my note was that I wrote this was for this question. I have had a few positions where I was nervous about taking them because I felt like I couldn't do them. And one of them was my first job out of grad school was coordinating the Minnesota organization. Okay. So I was the coordinator, so I wasn't director of the whole project, which encompassed some pilot projects, public-private collaborative at Minnesota Planning. And I was the coordinator, and I had to make cold calls and build a coalition with the board of directors for this advocacy organization, and it was great. And the person I reported to, even in my young, inexperienced age, knew she couldn't do the job. So she ended up losing her job, and the person who was our direct supervisor at Minnesota Planning came and sat down in my cube, and I'll never forget, she kind of plopped down, and she said, we're going to be asking her to leave, and we'd like you to have the job. And this was after less than a year. And I said, I don't really know if I'm qualified. So I was in my 20s, she was in her probably late 50s, early 60s, and she said to me, Donna, that is not ever what you say to your boss. Excellent life lesson. So I guess, and then the job I'm in now is director of a national center. So I've done a lot of work local level, a lot of work state level, sat on national committees. I sat on the board of the national organization to prevent on adolescent pregnancy prevention. So I've done some national work, but I've never worked nationally in running the center, and it was on vision. I knew nothing about vision. I never learned about vision in public health. I won't even tell you what grade I got in some of my public health classes that involve science and math. And here I was in vision, and the eye is very complicated, and I didn't even know how to say amblyopia or strabismus. Now I do, I get there here. But I was a little nervous, but the person who referred me said, you could do this job, and they actually hired me, even though I had no experience in vision, because of my 30 years in public health. Not because I knew vision, because you could always learn vision, but I was nervous. Can I handle this job? And so I guess my advice, and I'm sure we all agree, is be up to the challenge, because just have confidence in yourself, or at least hide your lack of confidence. confidence. But don't shy away, and I just don't ever tell the supervisor, I don't think I can do something.
So, like Donna also, I'm not a good math and science combo, so I didn't like biostatistics at all. I took it passing fail, and I passed. But it was very interesting, so I had to do a project. So combining biostats and EPIN, I had to use Anacoba, and I was so proud of myself because there was no way I thought, right? It actually made me sound really smart, you know. So here I am digging out with the numbers, and oh my goodness, I'm really good at this. And here I thought I wasn't good. The point I'm trying to make is some of the core public health courses that are tough, stick with it. And try to at least like it so that you can understand it, because it will come in handy one day. One day around the table, you actually have to prove that you're really smart and you may need that. One thing that the program didn't give me, so I also graduated about 13 years ago, was more hands-on practical things that you can use, right? So here I was serving on a board, and I was the board chair, and I didn't know a lot of management, effective management, how to manage a board and stuff like that. I know that we say that the course is holistic, but I think it could use a little bit of a modern day twist, right? So what is our world today like? And what are all the skills that we need to be successful today? You know, so an expansion of some of the advocacy, the management, some of those leadership courses, I think would be great for all of you and those who come after you, because you know the world is waiting, right, for you to come and help heal all these inequities and stuff. It is this generation that's going to make it happen, so you need to make sure that you're well equipped. But I think in terms of what it actually provides for now, I think is well rounded. I'm glad to hear that there's some interest in learning what else, right? You know, so you've got it. Stretch yourself so you can take advantage of what else is there, because it will come in handy.
So, you know, I would say one of the things that you learn right away when you graduate is that the real world and doing something in reality is, you know, it's different than doing something in fourth grade in a course. And one of those things I found right away was evaluation. I took, you know, of course, a program evaluation course, like I think you have to, or that many of you do. I don't remember this requirement, but you know, and it prepares you to do things on paper. And I think the kind of program evaluation that I do and I did in my first position, and that many of us do, you have to work with people. That's the thing, like you have to do. And you don't do that necessarily when you are, you know, doing coursework. And so I think the human element of bringing something from paper to reality should probably not be, you know, not be underscored. Or should be underscored. I think that was a piece for me that was a big learning right away. I was like, okay, I know how to do all this on paper, but how do I talk to folks or convey the importance of this? How do I help people understand what I'm doing and why I'm doing it? I would say another piece that I kind of stumbled into, and again, it was like just projecting confidence even when you were internally going, I don't really know what to do, is again the project management piece and getting into things. Again, you know, Rosemond talked about credibility. Sometimes it's like, oh, you have an MPH, here you go. And you're like, oh my God, I don't know how to do that. And they make assumptions about your skill set in some ways in a good way, and it pushes you. But you know, like, oh yeah, no problem, just manage this big, huge federal grant, submit these invoices, and manage 4 people, and you know, all these skills that you don't necessarily spend a lot of time honing in graduate school. So again, I think, you know, having confidence, even when it's you know, maybe not there, misguided or whatever, but asking questions. And don't be afraid to ask people around you. for help. Don't be afraid to ask your mentors for help. That's why you have them. Don't be afraid to, reach out to people in the field that have been that have guided you through things. That's what they're there to help you with. So those are things that came to mind for me right away when I think about what skills that I immediately was able to take into my work. A skill that I didn't probably work as much on, or at least I think I probably thought I was very competent at this, but nobody is, and we're all growing at it all the time, is cultural competence and humility. And my very first job was working at the Indian Health Board in Minneapolis. I worked there for about 2 years before I got my job at Team-Wise, Minnesota, which used to be called MOAB. That's the acronym Donna was referring to. So for a couple of years, I worked in serving the urban Native American community here in Minneapolis, and it's a federally qualified healthcare center. And walking in as a white woman who's managing a grant that was intended to improve infant mortality rates for Native and African American folks. You think that you're ready to do something like that. You think, okay, I've got this, and you don't got this, or at least I didn't have it. And I learned a lot, and I'm still learning. And I think one of the things that humility is, I think, probably the biggest lesson I learned in that, and letting community and letting the community guide you, letting people solve their own problems, letting folks tell you what they need rather than us coming in and telling them what they need is something that we can all do better at, or at least I can. I should not speak for everyone. I can do better at it.
Yes, please. Yeah. So I wanted to add a bonus in addition to what Jill just said. Take the grant writing class. It will come in handy.
Yeah, absolutely.
Echo. I do a tremendous amount of grant writing, and I've learned it all on the job. So I have just a couple of things to add. I feel like I got out of this program, and I learned this program helped me learn how to think analytically, how to really read a research study, and I still sort of do go straight to the discussion. But to really understand what's a good piece of research and how to analyze and how to ask good questions. I have a friend who's also an MPH, and we were talking one day, we were both looking for jobs, and she said, well, I don't know how to market myself this way, but I feel like what I really want to say is I go to meetings and I ask good questions. I said, oh, me too, that's exactly what my skill is. I go to the questions and I go to meetings and I ask good questions. And actually that skill, I think, came from being, part of this program, probably just being a graduate student, being older, but I didn't feel like I got that from my undergraduate program. And also I really echo what Jill said about, I came out of this program after, you learn so much, and what we were told was we were learning how to be MCH leaders. And so I thought I came out at the ripe old age of 28 being a leader and knowing everything because it was in the books, and I took evaluation, which was a really important class for me. I've done a lot of that work. And I knew what I was doing. And same thing, I got a contract with Planned Parenthood of Minnesota and the Dakotas, and it was a short-term project working in substance abuse and family planning clinics, and we were piloting something up in Duluth. And I, went to the research and did all my, lit search and developed this whole program. I went up to Duluth, and it took about 4 months until the program coordinator there said, we've been working on this for a year. You've never asked me what we did before you came. So you're going to, I would call that a failure. I mean, you're going to learn from all those experiences, and it really is that humility, cultural humility, but humility in terms of, what you're learning here is just to keep in mind that this is very ivory tower, and the way it works in the field is quite different, and I will directly relate that to what I am, my job right now. So our center, National Center for Children's Vision and Health, we put out guidelines, national guidelines, and we have experts upon experts, ophthalmologists, optometrists, around what is evidence-based vision screening, and when you should do it, and with who, and under what conditions, and how it should be done. So our evidence really is only for the preschool age. And then we get school age, and and it's just this whole controversy over an instrument-based screen. There's like a little camera machine that takes a picture of the eyes versus the chart, right? When you read vision charts, and I know if you're not interested in vision, this will not at all be of interest. But the point is, we have our recommendations on the national level, and we publish them and disseminate them. And then I hear, and it just came from a meeting in the Office of Public Schools, like, well, but we can't do those charts the right way. We don't have the right conditions. And with the instrument, with the camera, we can see 200 kids in an hour. And why are you telling us we can't do this for school-aged kids? I say, well, the evidence isn't there. But then there's reality. And so it's very interesting whether you're working on the state level and dealing with local communities, or on the national level dealing with states and national communities. What you learn in school and what the right way is and how the programs are supposed to run is not necessarily what the reality is on the ground, and how you deal with that. And I've learned over the years to really, and my note here is, you know, to listen, because people have their lived experience and they're very professional in their roles, and even if it's not what we think is correct, you know, it's a balance, and it's a line, and you learn, and that brings in kind of dealing with people, understanding how to manage people and manage knowledge.
So that is a great question, and I thought I would be working in teen pregnancy prevention. And so what I ended up is so different for what I envisioned, but that is also called life, right? But I think, so for me, some of the path, these deciding factors was a combination of the volunteer work that I did. So I served on the Maternal Child Health Task Force for about 6 or 8 years. So like Donna, I understood a lot of the federal stuff because it's the federal block grant, right? So I learned a lot from them. And then because they were all leaders in the community and from the state, various agencies, I was able to also learn a little bit about their work and develop relationships with them. At the same time, I served on the board for Books for Africa, right? And I ended up becoming the board chair. But what was important was I was still working as a birth certificate, a birth recorder. But so the combination of my volunteer work propped up my, so when I say that I can apply to almost any position, because I have a lot of experiences that I can bring, right? In the same vein, I also was I served on the advisory board of the Office of Multicultural and Minority and Multicultural Health at the state. So I ended up getting a lot of expertise, and so I am a self-made equity practitioner, and I'm proud of that because I took all of those experiences with my core holistic public health MCH knowledge, and I became who I have become, right? So key thing here is don't take your extracurricular experiences and volunteerism for granted. It helps bolster whatever, because that is actually what makes you, right? My boss was telling me yesterday why she decided to hire me. I was sitting on my high horses thinking I was all that. But when she told me yesterday, it blew me away, right? Something I didn't even think of to have put in my resume. So when you are presenting yourselves, every piece of you is important. Every piece of your lived experience is important. Don't shy away from letting people see the real you and the whole, all of you, because you don't know which part of you is going to be that which moves people to be attracted to what you bring to the table.
That's a really good point. I've done a tremendous amount of volunteer work, and I do have that on my resume. And there's very different ways to structure your resume, whether it's skills or jobs and then volunteer. So if you've done some really significant volunteer work, put that under your skills section, right? So it doesn't look like it was just volunteer work, because it's not just volunteer work. it's building professional skills. I wanted to tell you just a little bit about my path, because I'm very aware that there's one man in the room besides the gentleman in the back recording. So when I had my first child, who is now 23 in a couple months, I was working at Moab, and I asked if I could go to part-time, and they said yes, and then we moved away a couple years later. So when I moved to Chicago, I was just having my second child, and I wanted to continue to work part-time, and I was in a new city, and had to make all the contacts I think I mentioned before. So I decided to be a consultant, to try to do consulting. I had these years of experience, and I would, childcare-wise, it's tremendously expensive. Childcare is tremendously expensive. I think I paid more than I paid for college for my kids in childcare. So, but the point is that I work part-time, and there are pros and cons to that, and I'm happy to stay outside and talk to people about that. But I often didn't have a choice of what kind of projects I took, because I'm not great at marketing myself. We didn't necessarily learn that, right? There were no classes in marketing. I didn't really understand how to market myself. So I used contacts. I did a lot of informational interviews, which is also another great way to network and get out there. And people would say, "Oh, well, I'll hire you for this project," and I'd only gone in there for information. And that really exposed me to a lot of people in Chicago. That was the first thing I did, was informational interviews. But I have managed to cobble together a career working part-time, and I really thought that I was doing a great job. That I was able to keep my foot in the door. I live in a community where many women weren't working, and then when their kids got to 12th grade or 10th grade or whenever they decided I wanted to go back to work, they had lost all of their skills in their profession, and then they couldn't find work, and they had to completely change. Or 90% of them became yoga teachers, and these people have been attorneys and doctors. So I was really, people say, "Well, you kept a foot in the door." I'm like, I didn't keep a foot in the door. I worked. It was. So it's tricky. Part-time is, and I'll be very honest, there were many times I felt like I'm half-ass at work and I'm half-ass as a mother, because I work at home and the phone's ringing and my kids had the instructions: if you're not bleeding or vomiting, you never talk to mommies on the phone. And that was my rule. But that is how I managed to stay in public health. And sometimes I took projects that were, out of my realm, and again, it goes back to don't think you can't do something. But I didn't always have a choice of what I did. It wasn't like people were knocking on my door. I tended to knock on other people's doors. But I am in this position now, and really I think every consulting job I ever had has given me skills and networks and contacts and background in literature that is helping me in my current job. So I had worked for a early childhood program doing grant writing. And I'd never really worked in early childhood, and now my whole focus is vision in early childhood, and thank goodness I have that background. So if I only had a few jobs or stayed in teen pregnancy and then, lost the job and wanted to do something else, I wouldn't have had that varied background. So consulting has actually been kind of interesting, but it also was very unsteady income and no benefits and no pension. And I'm now heading towards retirement and thinking, crap, I should have stayed working for the state because I have a good pension. So, there's pros and cons in both ways. Health insurance, struggle with health insurance. My husband owns a small business. So there's very practical things to look at in your career. And like I said, in some ways you make your career, and in other ways life happens, and you have to be adaptive. And so I've managed to be a mom and be home for me with the right amount of time, 50%, and work and still have a good career and land this good job now. And that's why I have how much money I'm making. Like, I should be making twice this, because I really took a hit by working part-time, and I don't regret it, except now I look at colleagues and what they're making, and I just think, maybe that wasn't the right choice. So there's just a lot of balance, and I've done a lot of work on women in the workplace, and it's very tricky. The world is just not perfect for women in working.
Well, my path to get to where I currently am has also, like everybody's story, has been an interesting one. But if you had asked me 10 or 15 years ago what I'd like to be doing, I would have said exactly what I'm doing. I'm really fortunate. Let me tell you a little bit about how I got to be where I am today, because I talked a little bit about my earlier career, kind of right out of graduate school. But I worked, as Donna said, and as Donna did, for some years, about 8 years, at a nonprofit organization. It was called Minnesota Organization on Adolescent Pregnancy Prevention and Parenting. And then we changed our name to TeenWise, which was much better. This is a very long acronym before. So we changed our name to TeenWise, and so I worked at TeenWise. TeenWise closed. It was one of these small nonprofits that was kind of this intermediary organization providing support, training, resources, advocacy to folks that were working in adolescent sexual health, teen pregnancy prevention, support for teen parents and young families. There's not a lot of money out there in the world for that kind of thing, unfortunately, as time has gone on. And so the organization had to close in 2015. And so that's not an enviable place to ever be in your career. I don't recommend it. But one of the things that I will say is that I did not have to necessarily even really look for a job. People, because of my skill set, I'm gonna brag, because of my skill set and because of what I had done in this field and because of the things I was doing for people in our community, people came to me and they said, we'd like to offer you a job. And I was able, and that's why I have my own title, people. I created the job that I have. Because they brought me on and I said, this is what I'd like to do, this is what I think I can contribute, these are the ways I think that I can help you achieve your mission and your vision and your objectives, and they said, cool. So that's a good way to do it if you could do it. But it doesn't, I definitely had lots of moments of self-doubt and thinking, can I do this? Is this legit? Am I qualified? Can I make these demands? Can I do all of that? And you have to. It's the only way to move yourself forward in the way that you deserve is to advocate for yourself and demand things. So demand things and get what you're worth. I'll say that. The other thing I wanted to say about sort of where I am today is that I have actually worked in teen pregnancy prevention and adolescent health for 15 years, for my whole career. And I sometimes do think about my skill set and what I can do, and I think, gosh, am I too limited? Have I, kind of painted myself into a corner? And so I often think about ways to market myself and my skill set with bigger skill sets that are not just related to the content that I know. So I think a lot about, and when I talk to people, and I'm not looking for a job or anything, but if I were, I'd be thinking about things like program management, budget management, supervision, marketing, presentations, public speaking. These are all things that are absolutely needed and critical in pretty much every field that all of us are interested in working in. And those are things that, as Donna is saying, you might, find yourself in a situation where you're being, offered or interested in a position that is really different than the content knowledge that you have. Lean on your MCH program and lean on what you're learning here and think about these really big content areas that I think are the building blocks of any really successful public health career. Go back to that anytime that you're feeling a little bit like a fish out of water. I think those kind of things serve you really well to kind of just remind yourself, like, yes, I know this, I'm qualified for this, I deserve this, and I'm asking for it.
So all the positions that I've had are trailblazer positions, so they're usually new positions, right? So I went to St. Cloud Central Care Health to build a program for them for 8 years. At Blue Cross, they had a strategy, and I was hired to come and implement it, right? So they know, for one, that I'm a self-starter, and I can either create something from scratch or take someone's vision and bring it to reality, right? So that is one of the ways, like Jill said, I market myself. Okay, so I call myself a trailblazer also. So you can actually coin so many terms for yourself. It's free, So how do you distinguish yourself? Because they won't see you. They won't see how wonderful you look. They'll be looking through a pile of papers. So how do you stand out? And that's going to get you right. So usually they are looking for culture fit. And to be very honest with you, I don't know what Americans mean when they say that, to be honest. What does culture fit mean? That's what they all say, you're looking for culture fit. But beyond that, they're looking for something unique, right? So how do you make yourself unique and make yourself stand out?
Kind of a spin-off on what Rosemond said. So I talk a lot about how I have what I say is my unique combination of skills of being a big picture thinker with great attention to organization and detail. So after working at MOAB and professional training, I was, with MOAB, I'm licking envelopes. It was before we used email for everything. That's how old I am. And so I was licking envelopes. I didn't have an admin doing that. I was everything. So, building a mailing list and learning how to do a mail merge. And also, I have from this program that big systems perspective. So for this job I'm in now, just for instance, and of course I've had many positions in between, vision, we're all about promoting vision and how can vision, get more kids screened and more kids into eye care. And they hired me because of my big picture vision, because of my big picture thinking and being able to be a visionary. Yeah, there's really great little puns around here. Because, so we have this evidence, but vision doesn't occur in a vacuum. And that is one thing you learn, all these models, the ecological model and family systems models, that no one issue you are working on, and it really learns to teen pregnancy. One of our colleagues who's on our board, so I'm sure you know, developed this concept of the teen pregnancy prevention puzzle, and it had about, and it was, all of the things that need to be in place to effectively prevent a teen from getting pregnant. And it was systems level, better education, access to jobs, better systems for working with people of different cultures. And then, sex education, access to birth control. So, kind of what makes up individual choice all the way through the big, the big systems. And so, that is, I call that a unique skill set, because yes, I can count widgets and I can put together training folders, but I also have that big picture perspective. But one other piece of advice I'd give you, and this is after hiring over 30 years, a lot of people that I've hired, and interns also, the cover letter to me is just as important as the resume. And if someone doesn't understand my organization, I will immediately put it aside. So you have to do your homework on an organization and find out what their mission is and restate it without regurgitating what's on their website, and then how your skills will help them reach their mission. And then, and as I say, I'm very literal about this, address some, if not all, of the areas of that job description. I can't tell you how many jobs, sometimes they forget to change the name of the organization. So, everyone makes mistakes. I worked with my organization to prevent blindness. My initial cover letter said, "Dear Preventing Blindness." So everyone makes mistakes. Everybody makes mistakes. Everyone makes mistakes. But the rest of the letter was all about what they do and how I can help them achieve the mission, even if I didn't have the name right. So I think that I love the idea of saying trailblazer, and that I use the word leader a lot, because everyone's looking, if they're looking for a leader, if it's more of a staff line position, you have to really understand what the job is. Really think about what it is you're doing. Talk to people in terms of, that you might know who've had jobs like this or have worked in that organization, to really find out if it's a good fit, and make sure that you are selling yourself in the right way to that organization.
Donna just said everything I've ever done. Research the company, talk to people, name drop, what not to do, everything. The only thing I would say, as somebody who hires people in my current job, one thing that I think is a skill set for everybody who's applying for jobs is learning how to be succinct in how you answer questions. If they are asking you for an example of a time you did something, give them a time you did that, and then stop talking. Do not give them 5 or 6 or 7 examples. They're going to tune out, and it's very easy for people's minds to wander onto like, And the other thing I was going to say is that for sure research the company, I agree with that totally. But many companies or organizations or institutions have a way of talking about what they do. You need to understand what it is. So, look at the verbiage that they use, look at the language that they use to describe what they do, and I'll leave it at that. That will, and use that language when you have your